I play a lot of sports, and I was playing soccer and I was having an issue with just a lot of muscle tightness in my hamstrings. And I had been also doing like a circuit training where I was working out with a trainer, and I was doing some lifting, and I ended up just all of a sudden having a very sharp, intense pain in my lower back. All day long I drive, and I'm having so much pain coming down my legs that I'm anxious to hop out of the car so I can stretch. And I had exhausted everything that was there available for me, physical, therapy, exercise. I did everything I could to try and, strengthen my core muscles to try and support my back. After it got to the point where there wasn't really anything else that could be done medically to intervene, I wanted to see a neurosurgeon.
Corine is a very athletic person, and she presented to me with chronic back pain. She had told me that she had pain for many years, but it was getting increasingly worse. She had started to get pain in her legs, numbness.
It wasn't my first experience with Michigan Head and Spine because my husband had suffered a concussion, and so I had been into their facilities and met with their other physicians, and I was very aware of what they did and their level of professionalism.
I looked at her MRI and I said, Corine, I think you need surgery. And the reason is the following. She has very good sagittal alignment until you get down here. This is L5-S1. She has about a grade 2 spondylolisthesis. What is happening is the L5 vertebrae is moving forward with respect to the sacrum. And as it does that, it impinges upon the nerves. This is the exiting L5 nerve root, controls what we call dorsiflexion, or lifting your foot up. You can see the compression of the L5 nerve root. You can see the L4 nerve root above. The L3 nerve root is nice and open, there's plenty of room for it, whereas this one, the nerve is being pinched and squashed as the vertebrae of L5 moves forward. This occurs because of a break in a part of the vertebrae called the pars interarticularis. She may have gotten it from a sports injury. Some people feel that the patient might be born with this problem.
When he told me that he could restore my back to what it should be, and then I could go back to doing everything that I want to do, my next statement was, well, when can I have the surgery?
This is what we did. The device, it allows us to go into the disc space, restore the height of the disc, and then inject the patient's own bone into the disc space. You see how the end plates of the vertebrae are curved? This is a unique design that we incorporated into this implant. And why that is so important, it's because it allows these screws to pull the vertebrae back into alignment. And you can see we went from a grade 2, where she was one vertebrae in front of the other, to a grade 0. As a surgeon inventor, I recognize clinically what's important for the surgeon. I also recognize technically what's needed for me to achieve these kind of results. And what I recognized was that we needed to develop an implant that was relatively easy to fit into the disc space. Therefore, the implant had to be relatively thin. And then the implant needed us to allow in one movement to restore the height of the disc. The ends of the implant needed to be in a configuration that would allow it to seat in the center of the disc. Additionally, the implant had to be configured to pull the vertebrae back into proper alignment. The majority of the current implants that are on the market will not allow that. So this is a very unique design. We've really been able to help patients like Corine.
It's phenomenal when you look at my surgery scars. They're, about the length of my finger.
These techniques are all done through 2 small incisions in the back, and they're done to preserve the normal anatomical structures of the spine.
It's truly amazing that he can do the surgery, as extensive as it was, and do it in a way that I am feeling this good this quickly.
She's a young patient, has a full life ahead of her, and this is essentially a curative procedure for this patient.
6 weeks ago I had back surgery and I'm back to work and I'm feeling good, and I absolutely want to go surfing and go back to my sports and working out and, you know, enjoying everything that there is to do outside. So I'm looking forward to summer.